here. I had the funny experience of seeing kind of a full circle. 52 years ago, I helped a kind of wild, rebellious young man named Mark Maselli start a community health center in Middletown, Connecticut, called the Community Health Center, Inc. And he started it with a single dentist. And he had one afternoon a week. People could come in and get their teeth done from the low-income communities around North Main Street in Middletown, Connecticut. And then he got 2 afternoons a week. Now he's got 220 locations, I think, but they don't have dental care everywhere. In other words, that pendulum swang. Let's stick to dentistry here. It's come around full circle, so that obviously we're not getting the appropriate level of dental hygiene to our entire country. So, Dr. Simon, how can we share best practices of what we've seen in health centers to improve the integration of dental care with primary care and expand access for patients?
I think we have a model for that, which is the many large consolidated health systems that provide the bulk of medical care in our country. They employ vast numbers of healthcare providers, but very rarely have dental providers as part of that mix, even though they are receiving subsidies that are related to oral health care. For example, for all of the emergency department visits, where, by the way, Senator Cassidy, you can't get a tooth extracted. The emergency department can't even do that for you for the most part.
I got a friend that does it, but I'll leave it there.
That's amazing. I wish all EDs had that, but most of them don't. So I think we have a lot of work to do of using existing health infrastructure in a more efficient way. If we could build a clinic into every hospital, that's one less location people have to go to get their dental care. And I would note that while there are amazing private practice physicians like Dr. Isbell, the younger generation of dentists is more interested and more likely to work in different locations. And I think a lot of young dentists would jump at the chance to work alongside their medical colleagues in a setting like that.
Yeah, I think you're exactly right, and I think it should be, we should have a sense of urgency about this, more than what we see. And again, Mr. Maselli was a community organizer, is how he got into this, but he was constantly bringing together persuasive arguments about this. And one of the things I remember vividly, 40 years ago at least, and Dr. Minter-Jordan, maybe I'll ask you as well, they saw and heard alarming stories of kids from disadvantaged backgrounds who had real self-image problems having to do with their dental hygiene, and felt they didn't want to go to school. They didn't feel comfortable in the neighborhood. Is there research on that demonstrates that how valuable that is?
There is research that, and Senator Hickenlooper, and thank you so much for raising the very real fact that there are so many children who go without oral health disease prevention, and therefore, and I shared this story in our opening, young children as young as 3 years old need to be put under anesthesia in order to fix some of those cavities that cannot be fixed in a dental chair. This certainly impacts their ability to participate in their education, to have self-esteem, and then as they become adults to be able to seek employment. And so happy to share additional information with your office on this important topic, just underscoring the real need for prevention and for education.
Thank you. And last question. You've talked all of you have talked about the dental workforce shortage and what that means. And I think Colorado's been working very hard to lead in this effort to educate the next generation of dental hygiene professionals. We've got Community College of Denver and the Front Range Community College, Colorado Mountain College, Pike Peak Community College. I can go down the list of all these institutions that have committed to expand their programs by 2025 because we're asking them. We're reaching out and providing some funding. This is going to certainly help expand the workforce capacity, especially in diverse and underserved communities. But I'd let each of you, and I can just do this quickly because I've only got 38 seconds, what else can we do to help foster the growth of dental support professional programs like the ones we were talking about in Colorado at more schools, more training programs, more states?
People have to believe that they can be in this field. If they don't see anyone that looks like them or they aren't able to visit a dentist themselves, then they won't be able to. When I was in dental school, I was one of the very few people there that didn't have a parent who was a dentist. If that's the only way you can enter this field, we are not going to do a good job of diversifying it.
I would quickly add, we need to continue to remove the siloing between dental oral health and medical health and ensure that we're cross-training and create the idea of interdisciplinary teams that are focused on the patient and their families.
We need to incentivize people from underserved communities to actually go in to get the training, who are culturally sensitive, and return to those communities.
Exactly.
We are doing that in Alabama. We're trying to develop programs where students that are in high school from rural areas, it's really hard for this, even with the social media, as Dr. Swan's mentioned, to get students, once they've gone to Birmingham or Atlanta or Nashville to a dental school, they've got student debt, to get them to go back. We have probably 6 counties in Alabama that, you know, there's some of my guys that are still there, but there's not any young dentists there. So really get them there. So really giving opportunities from the financial base of it, of them going to school with contracts, they understand what dentistry means and why it's so important to the patients, because those patients in those areas deserve quality care.
Right.
It's really important. And then open access when they're in our hospitals. Like I'm served on 2 hospital staffs for 43 years. But guess what? All the dental equipment's gone. It's dead. All my Down syndrome, all my special need, all my nursing home patients. Guess what? There's not an OR that I can go into for those very apprehensive, for those very severe. I have a daughter that lives in an electric wheelchair that has SMA. I understand disabilities. I understand barriers. So we bring stretchers into our office in Gadsden, Alabama, with ambulances, bring them to us to take care of those people who deserve care. But some of those people, it would be really great if we worked across medical borders and we had an opportunity to seal, whether one Friday a month or whatever, to see those patients. General dentists are doing that. General dentists have done that for 50 years, and general dentists can do that in your state and mine, but that's not happening anymore. But we've got to educate young people the importance of how great a profession. Dentistry is a wonderful profession. I think everybody.
No,
here
we've
at the
got.
table-
I don't want to. The chair is going to come down on me. I'm already 2 minutes over. But anyway,
Gonna wait
I think
for the
this is
next
one of our
hearing.
best panels.
Okay, good. Thanks, Senator Hickenlooper. Senator Kane.
Thanks, Chair Sanders, and thanks to the panel. Dr. Swan, I want to talk to you about a part of the world that you and